Hi, I'm Dr. Craig Sawchuk, a clinical psychologist at Mayo Clinic, and I'm here to talk with you about anxiety, what it is, what causes it, and how to treat it. Whether you're looking for answers for yourself, a friend, or a loved one, understanding the basics of anxiety can help you take the next step. Anxiety is a normal part of life. We all worry about certain situations from time to time. But anxiety becomes a problem when it starts to interfere with daily activities, causes you to avoid places or situations, and makes it hard for you to enjoy life. People with anxiety disorders frequently experience excessive and persistent worry, intense physical symptoms such as panic, and uncontrollable fear about everyday situations. The good news is that anxiety disorders are common and very treatable. In fact, anxiety disorders are among the most common mental health condition, affecting over 40 million adults in the US alone. While anxiety affects people of all ages and backgrounds, women are twice as likely to be affected as men. Given that clinical anxiety may cause significant problems in day-to-day living, it can also be common that those struggling with anxiety may also struggle with other mental health conditions, including depression and substance use. Anxiety often creates a cycle of feeling, thinking, and behaving that's designed to keep you trapped. Anxiety is known as an up-regulating emotion. So physically our heart rate increases, it can be harder to breathe, we sweat, we just feel on edge, and our muscles feel tight. It can be harder to think when we're anxious. And we often worry about worst-case outcomes, assume that these worst-case outcomes are really likely to happen, and we doubt our ability to cope, control, or even recover from these things if they occur. When we feel physically uncomfortable and struggle with the intensity of our worries, it makes sense that our behavior also changes. When anxious, our behavior can change in two ways. Sometimes we just don't do enough of something, like avoid those things that cause us anxiety. Other times we may actually do too much of something, like seek reassurance, constantly check things over and over again, or use substances. We don't avoid or overengage things because they make us feel good. We often do them because they make us feel less bad. What causes anxiety? Anxiety can be caused by many things. Some people may have a family history of anxiety, certain personality traits such as shyness or a tendency to be more physically reactive to changes in the environment, or even health conditions such as thyroid problems may contribute to feeling anxious. Learned factors are thought to play a particularly important role in the development of anxiety disorders. Stressful events, including traumatic life events, can set up a learned pattern of worry and avoidance that maintain and worsen problems associated with anxiety across time. Symptoms of anxiety are different for everyone, and it may be a sign of another health condition, so getting an accurate diagnosis is important. Your healthcare provider may use a physical exam, lab tests, or a mental health evaluation to diagnose anxiety and create a treatment plan that works best for you. Several effective treatment options are also available, including lifestyle changes, cognitive behavioral therapy, and medications. Lifestyle changes can always be helpful. Getting enough sleep, physical exercise, diet, and incorporating relaxation and meditation. Perhaps the most effective treatment for anxiety is cognitive behavioral therapy, or CBT. CBT involves learning specific skills to better manage anxiety, such as exposure therapy, in which people learn to gradually and consistently approach those things that they have been avoiding in a more predictable and controllable way. Some people may also find benefit from medications to help manage those symptoms of anxiety. Always remember that anxiety is a very treatable condition. Help is available. You don't have to let anxiety control your life, and you don't have to deal with it by yourself. If you're ever hesitant to talk to a healthcare provider, talk to a friend or a loved one about how to get help. Living with anxiety isn't easy, but getting the support you need can help you start feeling better. Want to learn more about anxiety? Visit mayoclinic.org. We're here for you.